Hi, everyone, to this wonderful MedTalk today. We are here again to educate, to talk, to discuss a medical topic for all of you listeners, for medical writers, but also for the general public. This is an extremely interesting call today. Welcome, Shalya.
Shalya, yeah.
To our MedTalk today. We are going to talk about oral health matters and why it is so important to brush our teeth, but not just that. What is your background, and tell us a bit of how we landed here.
So thanks, Kathrin, for having me here, and thank you everyone for joining in. I am a dental surgeon since last 30 years, and I've always tried to call myself an oral health professional instead of a dentist, because I've always been focused on preventive aspects. So in 2020, I joined 2 masters, studied, and with all the combinations of diverse things that I've done in the past 6 years, I can calling myself a health economist or a healthy aging expert or a patient advocate. I've created my own trust, Smileage Initiative Trust, as a foundation to promote healthy aging through health literacy, because I believe health literacy can work and make really healthcare problems go down if people take shared responsibility. So that's why I'm here.
Wonderful. Yeah. I met Shalya. Sorry, this is. We met on Clear Health Communication, which is one of the groups that I co-founded. And it's all about making medical language understandable, right? It's all about understanding what the doctor is trying to tell us. And today we are going to discuss a topic that is extremely seldom discussed within the general public. I can speak for European countries, and also I've experienced that in Oceania. You are based in India today, but you live in the UK, right?
No, I live in the Netherlands. So wow. six months near Amsterdam and 6 months here in India to do my work. So yeah, wonderful. That's how.
Yeah, just to give the people an idea where we are moving, right?
Yeah.
But I think the issue is the same all over the world, isn't it? It's what would you say? What is the biggest issue?
I will agree with you, Kathrin. The thing is that oral health is neglected worldwide. WHO actually acknowledged that no health without oral health in 2021, when Dr. Tedros said it across the table. Recently, there are a lot of global policies that are focusing about improving oral health, but it's missing. The head has always been kept separate from the body, and that's what we are trying to unite.
Yeah, you prepared a presentation for us. Why don't you start guiding us through your way?
Thank you. The reason that I wanted to share a presentation is to bring the diverse things together, and I hope I can help people look at it differently. So why oral health matters? This is a bit about me, the diverse things that I've been doing. I'm the chair of the Oral Health Literacy Division from the International Health Literacy Organization. Apart from being a researcher, a dentist, so oral health is the core of whatever I do, despite the diverse studies that I have done. And why? Because oral health is a global crisis. There are 3.7 billion people across the world with oral health diseases.
Wow.
It's more than any other non-communicable disease. Can you believe 90% of oral health diseases are preventable? But we don't know how to do it. So my goal to do everything is that there are just 4 or 5 things: brushing twice a day, scaling, flossing. But people don't understand. And that's what brought me to you. And that's what we are trying to make a difference. So as you can see on the slides, 70% of the people have any kind of a gum disease already in some type of their lives.
What do you mean by gum disease?
Oh, so there are different oral diseases that we all know of. There is decay, and there is gum disease like bleeding of gums, your gums going down, periodontitis. So there's infection. So whenever we eat something, it stays on your mouth. If it's not cleaned in time, it gets hardened out. And it creates a sort of a friction between the gum and the tooth. And if you do not take care of it in time, it just increases. It makes your bones go down. It makes your gums bleed. But what the world doesn't talk about, because our healthcare system has been so disease-centered over the years, that we go to a dentist only if there is pain or if there's something very drastic happening. The main thing is that research has proved that there's a bidirectional relationship between the systemic diseases and oral health. And I've always told my patients, Kathrin, that this is the door to your body. You can clean your house very well, but if there is a pile of shit lying outside, it's going to leave its marks inside. So the same way, if your oral cavity is not good, it is going to affect your body. And research in the last 6 years, the number of papers that I have read about cardiovascular diseases, about diabetes, about adverse pregnancy. So if in pregnancy, if your mouth health is not that good, there are chances of preterm babies. There are respiratory infections. If a person is hospitalized and there's infection in the mouth, there's aspiration pneumonia. There are so many problems that happen. But what amazed me the most was the studies that said that Alzheimer's or your cognitive decline is also related to your bad oral health. Cancer, that's related. That's something that as a clinician, we were not so aware of.
Yeah.
So I will be talking about oropharyngeal and HPV-related cancers also, because I guess 2 days ago, I spoke in a dental college, and I can assure you that 99% of the doctors, the highest level professionals, had no clue that HPV also causes 7 types of cancers in boys or girls. So the mission is high, and the diverse or horizontal thinking is what I'm trying to propagate here. Just for an example, even though it's an international platform, let me talk about India's oral health crisis.
Yeah, sure.
130,000 cases every year. 30% of global oral cancer burden. Highest in the males. But what happens is the detection is late. You get a swelling, you eat antibiotics out of this thing. You ignore it till the last stage. By the time you reach the doctor, by the time the screening actually happens, it's gone. It's almost to the 3rd or the 4th stage. No one talks about HPV impact in oral health cancer, oropharyngeal cancers. And what I believe is that a dental chair can be a screening tool. So this is the presentation that I gave 2 days ago to the doctors.
Yeah.
So, but why communication fails, Kathrin, is there's jargon barrier. I remember the first thing that I heard when I was doing my European Masters in Health Economics and Management was communication gap.
Yeah.
There's asymmetry in information. And I'm guilty as charged because I belong to a doctor's family. I've been a doctor. So when we talk to patients about infections and oral root canals and, like big things, it's very difficult for them to understand. So that's why my language is very, very down to earth. It's a clinician language because I'm not totally a researcher. I have 26 years of experience as a clinician before I went into education. So I'm trying to break that jargon barrier, make it simplified language. Siloed system, dentists are different, physicians are different. Every other field is different. Oral health is not given that much of value because accessibility, affordability, availability, everything is down. No one talks about it in media. There's misinformation, and there's also the caregiver gap, because when the caregivers, like for example, if someone's hospitalized or in elderly care especially, then they don't know how can they ensure that oral health is important. So my solution that I present to you is health literacy as a social vaccine. You've seen that. You've read my paper.
I read your paper, and I was highly a fan of that. Yeah. As I just told you, I was doing all the exercises.
It's actually, how do I say, it's my clinician blood who wants solutions, who wants action. So for me, how can I make a difference? Not just publish papers, but how can I make a difference? And what I've seen all my life through all my patients is that people, when they come to me as a doctor, they don't make decisions according to what they know. It's not individual health literacy. It is a collective community decisions that are made. So when a vaccine, it protects a single person. According to me, when you educate one person, they go home and they educate 5 more. So
Yeah.
just like a virus spreads in an R factor, that's my goal of saying, the same way information can spread. The same way people can be empowered. So just to explain to people who do not know the definition of health literacy, there's find, understand, use of information. And in a dental world, how do you read prescriptions? How do you have the right kind of questions when you go to the doctor? Culturally, how they're different, how to be aware of the fake information which is out there, how to be able to choose. That I think is a very, very important thing.
Yeah.
And in my case, when I talk about social vaccine, Kathrin, it's not just individual protection, it's about community immunity. It's about how communities are protected because they know and they're empowered to make the right decisions. I am not teaching anyone during my sessions. I'm just telling them that, hey, this is the information. Everything else is available on the internet. So
I love the term social vaccine. I really love it.
What?
I might steal that term social vaccine from you. I really love that.
Oh, thank you. It's everyone's. It's a paper by Organ, and it was done in COVID. At that time, I wouldn't have ever imagined that I would be working with him, because now I'm in ILA. And for me, this is such an important thing because it really protects a lot of people. Please, it's all yours. No one has it. I wanted to spread as much as possible. So why this solution? Because the intervention is very cost effective. I'm a health economist now, so I want to use my resources in such a way that it can be scaled across the world. Educating people is always the easiest way. It's the most tough one, I must tell you, because changing behaviors is not easy. Yeah. I'm a researcher at Max Planck, and we've just written a paper with Max Planck director, postdoc, and a Harvard professor about this thing, about dental toolbox. It'll be coming up soon. That's another of my way to how we can actually impact behaviors. But
yeah, it all starts with habits, small habits. To this, I can really, if you want to change something, read the book Atomic Habits. I'm a big fan of it because it's so easy, and it is extremely hard to change your behavior.
21 days. That's all it takes. You do something consistently and it gets you there. But the thing is, it's a mode which is tougher. It's easier to give people a solution. I could easily do a dental checkups if I wanted to, but I'm not doing that because I believe that if we start educating people, if there are 50 people in front of me, and I say that even if 25 out of them actually understand what I'm saying, and they go back home and they talk to their families, I think we'll get there. I think gradually, slowly, and the kind of material that we're designing through our trust, it's across the ages, across different languages. And I think, as I say, there's not expensive, there's no treatment involved because it's all about prevention. And it can spread. We can create champions across the world and make it happen. So the part 3, the tailored communication, that's your domain. One message, many audiences. So what I'm going to show you is that in the last 1 month, it's been a very active month for me, for my team of the trust. We have adapted the same oral health messages for different audiences in different ways. As you can see this, if you're talking about that your mouth is connected to your whole body, and a healthy mouth prevents diseases, saves money, and adds year to a life. A very simple statement. As you can read, for a lay public from low literacy to a highest level literacy, from policymakers, the language changes. Because all of us understand a single kind of domain.
Yes,
so
definitely.
We've tried our best to change it according to our audiences. And I'm going to show it to you, and you're going to love that. Let's say if we talk to the communities. I have been talking to communities about HPV and oral health because I want to remove the stigmatization of women and marginalization of men. I want to ensure that people know that HPV causes 7 types of cancers, not just one, not just cervical cancers. And I believe that once you educate them, you empower them, and then they make their own decisions. So this is how we do the presentation. And I always start with, can you clap with one hand? I make my audiences clap. So then if they can't clap with their own self, which can't, of course, then they clap with the one neighbor, the one person sitting to them.
Yeah.
The kind of responses, Kathrin, which I have received from people, it's just so heartwarming. When you get a message saying that, hey, I got this done. And not just, I recently spoke in Delhi Public Library, and the chairperson said something very beautiful. He said, Shalya, for people who get, for the kids of today who have 30-second attention span, you managed to make them sit for 35 minutes to 40 minutes listening to you. I think that's a compliment. So
It is something, definitely, yeah.
I didn't think of it earlier like that, but it really helped me, and they become my champions.
Yeah.
If you're one, that's exactly the social vaccine, because there were people who came and told me that, hey, they're going to talk to them. So we change it according to the communities, we change it according to the clinicians. So recently I spoke to a college of neurophysiotherapy. So I went to a physiotherapy college, and I spoke to them that why physiotherapists should also be aware of the oral health. Because it's not just about muscles, your food, you're eating, you're chewing. Oral is not just dental health. Dental health is teeth and gums, Kathrin, but oral health is speaking, swallowing, smiling.
Yeah, interesting.
The impact of oral health on, if my teeth were not looking nice now, I would be sitting like this. I won't be talking well. And there are so many people who go into isolation, the loneliness, especially in older age, because their dentures maybe come off, or some problem might happen. And in case of physiotherapists, what I tried to plant the seed was that they should be, if they're aware that oral hygiene is good, because when someone goes through such neurological disorders, they won't be able to take care of the oral hygiene. And that could actually lead to bacterial colonization or aspiration pneumonia. And all the hard work that they do to make their people move functionally well will go down the drain, because outcomes would be worse because of oral infections. So there was a conference that I attended 2 years ago in Lille for MASC, the Multinational Association for Research on Cancer. And I remember talking to an oncologist that it just takes 16 to 17 seconds. Tell your patients, open your mouth. Any pain, any bleeding, that's it. You don't have to do much, but it will put it in that patient's mouth that this is also important.
I think it's so important for every other clinician also to just put it in their brains that there is another factor. It's, as you said, this is another part from the body for most of the physicians. Yeah. And once they understand that, I can think that it makes a big difference, because they're all smart people, right?
Yeah, and it really, really has an impact, because what happens is that if once they know the system, patient also is so aware nowadays. They know more than us. Hello? Hello?
I hear you.
Yeah, do you hear me? I thought, yeah. So I feel that they can really understand so much more than us once they know. Once they know. So as you just said, I do try to get into diverse setups. So HPV vaccination was my study, but oral health and cancer care for older people was my another research for my master's in healthy aging and rehabilitation.
Yeah.
It shows only one paper, but I've written 2 papers about the topic. And I'm very passionate about this topic too.
I hear that. Yeah, I love that.
Yeah, because the cancer care, every cancer treatment, especially chemotherapy, it impacts oral health. People have ulcerations. You can increase the longevity, but what about the quality of life of a patient if he can't speak, if he can't eat, he can't swallow? So if you have a dentist on board, if you do a slight intervention of making your mouth clean just before we start the cancer therapy, maybe it has an impact. So, and material vigilance, that's another topic of mine. That's another first.
I completely hear you.
Yeah. So to come to your topic, what do we do? This is us. Our aim is to make people aware. I would not say that I can make people change. We want to make people aware, and then they make an informed decision.
Yeah.
And we do three pillars, ORA, we call it: outreach, research, and advocacy. So through outreach, we collect data, we teach people, we do the research along with that. We come up with our interventions, and we'll see the impact. And through that, we will evidence-based, we plan to create advocacy. That's precisely how we're doing it. And this is a platform which is no longer just for oral health, even though I'm a dentist, even though oral health is my core. But I did it in such a way because we have such brilliant people with us. So it became a platform for anyone and everyone who wants to go and share a message. So right now, because I'm the main face of it in the beginning stage, we have 2 flagship initiatives, Smileage India and HPV. We call it Ek Se Saath. So in Hindi, Ek Se Saath is 1 to 7.
Right.
So
Yes.
one vaccine, you can actually protect your children from 7 types of cancers. That's our.
Yeah. Well, that is a good way to look at it, right?
Yeah. Yeah. Oh, we won a second award in, there's an All India Medical Institute. It is one of the premier institutes in India. So they had a cervical cancer innovation challenge, and we got a second prize for our ideas.
Wow.
For that, we did the health literacy as a social vaccine.
That's fantastic. Congratulations.
Thank you so much. So this is what we do from different things, creating toolboxes, infographics, and videos. For this, I just want to go a bit here. So this is my website, as you'd seen on the first page. And what we have done is we've created resources. And in video and infographics, this is how we are going to be portraying all the information. Like this, if you can see, these are validated things which have been done by the FDI, but it's a long paper. So what we are trying to do is making it into clear communication. And we've just chosen 4 of the exercises, which everyone should do. And it's very easy just to pick up, yes, thank you. To make our muscles healthy, because you won't want yourself to be drooling water for a period of time. It will also help in age. It's also anti-aging, if I may say so.
Yeah, I was just going to say, I used to do that for the wrinkles,
Yes.
It's not helping though.
It really works. It does, sure, I tell you, because for me, it is not just the exercise. It's the awareness that oral health is important.
Yeah.
If we are aware of that part, we will take care, because what is a healthy aging definition? There may be a lot of medical definition. For me, simplest languages, even at the age of 80, we want to eat what we want to, and not because we have to eat soft food.
Yeah. I keep thinking about that when I eat chips. I really like crispy food, and because cancer is a big topic, I know that many cancer patients can't eat fast, like crispy food. They only have the soft food, and I think this would probably be one of the worst things that I need to experience, is to just have the soft food going on. So this is my biggest motivation to brush or like to look after my oral health.
Yeah, and it's so simple. Just brushing before you go to sleep. That's so important, because you won't want the food to lie in your mouth for the next 8 hours. Allow the bacteria to develop, which will cause the acid, which will take away the enamel of your tooth. It's very simple. The bacteria never attack your tooth directly. They attack the food which is around your teeth. So if you have first flossed, then brushed, it makes a lot of difference. You'll find, and not spit the toothpaste away. Let it be in your teeth. Let it sit on your teeth for some time so that it has an impact. Rinsing with salt water also is something which I find is a very simple, cost-effective, inexpensive way to keep your mouth clean if you don't have hypertension, as I said. This, Kathrin, I wanted to share with you when you're talking about clear communication. This is another platform which is the love of my life. That is Oral Health Literacy Division of International Health Literacy Association. And we have created, in the beginning of the year, 4 webinars for us. We have already had one, and where we had patient advocates and oral health leaders. Now we have one on 23rd April, and I would like to invite whoever wants to listen. It's for older adults.
So this is going to be online?
Yes,
online.
We do it. It's on LinkedIn mostly.
Yeah.
But I advertise it on LinkedIn. It's also gone through ILR newspapers, but I can share the Zoom link.
Yes, please do that. When I share the post to this talk, you can share the invites.
Yeah, and I have amazing people who are joining in, from health economists to healthy aging experts to a geriatric dentist to an oncologist, radiation oncologist, a director of an institute in India.
Wow, that sounds amazing.
Yeah, they've invited me for a talk on 12th of May to give to the nurses, because I want to educate them how to take care of the mouths.
Yeah, that is so important. I've seen nurses who didn't brush teeth at all from their residents or
Yes.
patients, it's like, ooh, yeah, I've seen bad things, really.
I can understand. And that's, see, the thing is this, I understand nurses are also very busy. And if it's not a part of the curriculum, if it's not part of our systems and our protocols, it does not happen, because this was a part of my research too, apart from ageism, this interprofessional education is also, but is a big thing. And I feel that's what I'm trying to do. I can't change the system, but I can do whatever I can. And these webinars or conversations are a way of creating a platform where we could create oral health literacy modules for diverse fields through experts. And there I would need you, Kathrin, and your team, if anyone is interested, because I do have a beautiful team of Clear Communications Department too. Sheila Khwaja, the amazing Sheila Khwaja is my head of my Clear Communications team. And what we do is whatever I give her the information, whatever we create, it all goes through her. I have a head of research, Amrita Tripathi, who looks at it from a very scientific view. So my entire team before this presentation also has come out to you. It goes through everyone, Shivangi, Elizabeth. I have lovely people with me. I can tell you, I'm so blessed. And what we can do is we can actually create content, because if I have experienced, knowledgeable hands, I have lots of material. I have lots of research which I want to be translated. You're much more welcome, more than welcome to help me out with that. And through our platform, we share certificates, we share all the credentials. So please get in touch with us in case you want to join us.
So you need translators from English into other languages, or from English into plain language, like from medical English into plain language?
Yeah, right now English into plain language, just like I showed you on my website.
Yeah.
So that was an FDI document. It's a long 5 pages document. You've seen it too.
Yeah.
Out of that, we picked up just 4 exercises, because I've been a dentist. I know how many people remember. Trust me, once they see with pain, for the first 10 days, they remember very well, they'll brush, and then it goes down. So I want to create such material that they can paste it on their walls, and they can just remember. So that's the aim. And
I just remember that I was supposed to give you, and I have it here in my suitcase. Here I have the app. I was at the dentist with my daughter the other day, and I asked, you remember we talked about the app how to brush teeth for kids? And now I have it. I wanted to send it to you, but I will link it into the post edits as well. Yeah, great. Fantastic. I really think that everything you do is so highly valuable and important for people, just to raise awareness. Yeah, you can't, as you say, you can't change them, but you can make them aware.
I can do my bit. That's what I do. That's what we do.
I think you're doing amazing. You're doing a lot of work. And a big thank you to the team behind you too. I know nothing goes without a team, right?
No. Without Amrita, Elizabeth, Sheila, these are people who just hold me together.
Yeah.
I can't tell.
Well, you sound like a very busy woman.
Oh, day after tomorrow, I'll be speaking to healthcare professionals from a government medical college. So you can well imagine there'll be gynecologists, there'll be ASHA workers. The ASHA workers are the local community workers. There'll be nursing staff. There'll be nursing superintendents. So the entire team, and I'll create my presentation after your talk today, because that's how I'm one after the other.
What is the time in your place at the moment? It's
5:04 right now, 4 p.m.
4 p.m. Yeah. So it's, because you are in India at the moment, right? And you hold those lessons in Indian or in English?
So what I do is I do a combination of English, we call it Hindi and English, because I want to reach people. So in the hospital, I'll be doing it in English. But yes, 2 days ago when I spoke in the hospital, that was entirely in English. Yeah. So it's a combination. The slides are in English. I speak in English, because that's how people understand.
Yeah. So, wonderful. Yeah. That's a good point, right? Yeah. I wonder, how is it in India with like the availability of brushes and floss and the mouth water and all this stuff?
Everything is it's available India is so huge. It's
Yeah,
so diverse. So I will not say that in villages you're going to find mouthwashes and details. There may be, but you do find Colgate everywhere. So it's a funny thing that people do not call it toothpaste. Over the years, they've started calling it Colgate, but there's an availability of large number of toothbrushes, toothpaste,
yeah.
mouthwashes. But I grew up in a village, Kathrin. So we have this stick, it's called datun. It's a very local thing where it's a wooden stick which people would chew. I've done that too
Oh,
when I was a child. I've seen people doing that. And interestingly, it would release certain kind of chemical and people had good teeth because the idea of just chewing it also, it creates a musculature
yeah,
exercising. Today's generation has lost, there are many kids who are being born without third molars because the jaws are shrinking because the foods have become softer.
interesting. Yeah, that is very interesting.
Yeah, so our old culture, the things that we have in India are amazing. So it's like, I would not, that way, it's pretty good, but not everyone can afford a toothbrush.
Well, that is
And
the
that,
question, right?
yeah, but the problem is, it's not because it's not given the value that it truly deserves.
Yeah,
If someone knew that it's important, it would happen. But if you look at our basic cultural habits that we had when we were growing up also, rinsing of mouth, it's more in our rural areas. Gargling it properly after every meal. It's a habit which was inculcated from the beginning.
yeah. Interesting.
So
Yeah,
yeah, so despite the fact that I can say that cities have more money, it's not necessary that everyone in the city would be brushing because they have everything available. There would be people in the village who have better habits and less of junk food, less
yeah,
of chocolates and chips, which actually make a difference. So
yeah. Definitely, definitely interesting. I cannot imagine to not brush my teeth just because it feels disgusting,
yeah,
especially in the mornings, when you wake up and you have like that hamster in your mouth. So I do wonder how people can avoid brushing their teeth. But yeah, obviously, it's what I've seen in aged care also is that uh, people don't like it's very hard to get into the mouth of other people, and they would bite and they have like Alzheimer's or so, then they wouldn't let you in there. And it became very difficult sometimes to brush their teeth. So I do
yeah,
understand. And also what you said, there's no resources, there's no time planned for it. And yeah, I get it, it's difficult. But again, if they are aware, the nurses and the doctors treating those patients, then they might change at least a little. Maybe they just brush at least 30 seconds.
yeah,
Everything is
that's
better than nothing, right?
exactly. And if you realize, in the end of the day, all of us, doctors, as doctors, I may speak, we want the best for our patient.
Yeah,
We, if let's say, if you become very selfish and we don't want the best for our patients, but we want us to be great doctors because we want our patients to be correct, to be healthier.
yeah,
They get them relief so that they think that we are good doctors. So in the end of the day, if you take it as a total circle, if this is not taken care of, our healthcare outcomes go down.
yeah, definitely.
So
Yeah, I
I'm
really,
trying to put the head back into that, that body which has been cut, the two halves. I'm just bringing them together.
yeah. Let's bring them together, right? Yeah,
Yeah.
Jana, who was with us in the beginning, she also shared under the post on LinkedIn about this talk something about pregnancy and oral health. Do you have anything more to say about that? Because a very typical saying in Germany is, for every kid you will lose a tooth. And I would like to know your opinion about that.
Uh, Actually, that's very wrong. That if for every kid we should lose a tooth. I do not believe in that part because if we do take care of our mouth, so hormonal changes happen. It's a very normal thing, and when there are hormonal changes, your gums will get weaker if you do not keep it clean. But if you know that oral health is important, if the gynecologists tell our patients that, hey, This is very important that you go for a scaling in time. If you have any cavities, go for it in time. So those kind of stuff, if that happens, I'm just going to show it to you, share something with you because you say that. So give me a minute. And these are my slides. These are my slides from Loreto. I took a talk on 7th, the day I arrived the next day. So this is oral diseases in pregnancy. So I'm sharing it here so that if anyone wants.
That's wonderful. You can share the link to that too if you want. Then I can share it with.
Sure, but I think it'll also come in a recording now so people can actually see that.
Yeah, perfect.
Just brushing twice a day, changing your brush, flossing. People don't floss out here so well. And just because, and I have seen this myself too, if you brush your teeth and after that you try putting a thread between your teeth, you'll find the food will come out because the teeth are like this and the bristles do not go between the teeth.
Yeah.
Basically,
like half the work. If you don't floss, you just brush half of your teeth, right?
Yeah, exactly. Yeah. And interestingly, this is one part which I really want to highlight here. If you're vomiting, because every pregnant woman goes through the nausea, early morning nausea. I have 2 daughters, so I know that very well. And because it tastes bad, we end up brushing. We should not at that moment because the acid will take from our teeth. So how do you do that? How do you rinse? I am not a firm believer of a lot of mouthwashes because it has alcohol and it causes dryness. So how do you balance these things will only come through information. And if I show you this is for during motherhood. No stops about baby care. Brushing of the teeth does not happen till a very late stage. But how do you get your child to start knowing that this is important? You can't start creating a habit suddenly after 3 years. You decide that you need to brush. No, you need your child, you know that, and rinsing and baby bottle caries is a big, big thing. So this kind of an education. And this is something which is for both of us because I don't know about you, but I know for sure. For me, the water is coming.
It's coming soon, I guess.
So for me, no one talks about these things. We just hear one day that your teeth, like I remember meeting someone, my patient was like, hey, my teeth were perfectly fine and now there's decay. Why? Because of dry mouth. It's hormonal change. And our saliva keeps cleaning our teeth by itself. It's a self-cleaning mechanism. God's created a beautiful machine. But what we do is we forget that drinking water regularly, a sip at a time, can help us so much. So these are the certain kind of things I think which can really, now that I have the slide open, I want to show you this, Kathrin.
Yes,
because
please.
now it's going to your archives. It's a study from 2019. Cancers are 86 million. Respiratory disease 453. This was 3.4 at that time. Now it is 3.7 billion. Oral diseases, these are the oral diseases which have been found out. So are we talking about the fact that more than 50% of the world's population has these diseases?
Why do people not talk about it? If it is so many, then it's like half of the population almost. Why do people not talk about it?
That's a question that I've asked myself so many times. I think in global oral health policies, we have wonderful people like Benoy, Raman, Habib Benzian, Manu Mathur. I think Raman and Manu are actually a part of my team, my advisory group of my trust too. There's so many people who are working very hard, but they're working it from a policy aspect. And they've managed to bring it from the darkness into light, I must say that.
Yeah.
And they are working on a very different platform. I'm working from bottoms up. I'm trying to help them in my way.
Yeah.
So that if their focus is on those 3.7 billion who have disease, I'm focusing on the 4.4 who don't.
Yeah.
Even if I save thousands of them, lakhs of them, I would be happy. I would be really happy. So the diversification, why? Because our education system keeps the mouth different. Dentistry is different from the general health. I think that core belief has to be there, and it'll come when the patients or the people, general population, starts understanding that. that it's one whole body system and it's all interconnected.
Yeah, I would love that. I love the picture, like, let's put it together, because that is what it is. It is also nutrition. Nutrition is so important for many diseases. You just showed on your slide as well. That is another topic I could talk years about.
Please. This is something that inspires me so much. So go ahead.
Yeah, I think we would sit here tomorrow. I was at the chiropractor with my kid on Friday because she had some back issues. And then we started talking about nutrition. And then my daughter, like after half an hour, she's like, okay, we're here for my school. But yeah.
And you'll be so surprised. The moment you'll talk about chiropractor, my mind will go, this teeth balance has an impact on some. There are people who say that they have cervical pain, joints, this thing, but it is because they're grinding. No one talks about that. If this tooth occlusion balance is not there, your body posture shifts. There are studies.
Actually, our chiropractor knows that. Actually, he really looks from head to toe. Like I have so much respect for him. He knows so much, and he levels everything out, or like makes us aware of things. So yeah, I really, and this is what I experienced, like the people who are working with alternative medicine, not just the school medicine, they have such a better, clearer picture of the whole thing, like the whole body.
Absolutely.
So, yeah. So let's take that mission further, I would say.
Let's do that. And let's make the information easier for people to understand. I think for me, that is very, very important. So
yeah, what I heard once is that that was more for if you want to buy something, or if you want to sell something, then you have to see that, or you have to show to your maybe customers, wannabe customers, one thing 7 times. You have to make them aware 7 times before they actually really understand that it is there. So I think it's the same with our missions, you have a mission, I have a mission, and we need to keep talking and keep making people see the fact that, in my case, cancer communication needs to be better. In your case, dentistry needs to be more, or oral health needs to be more aware. So we need to keep the conversation going,
We do that. We keep working for it.
Yes. Definitely. Yeah. Wonderful. If you no, you go.
I say our tagline for our trust is, it's one smile at a time to reach the unreached. And for us, reaching the unreached can happen when we treat health literacy as a social vaccine, because through this, what we are talking today, we're actually spreading health literacy as a social vaccine, because we don't have a clue how many people are going to listen to us. But if it impacts them, if it resonates with them, look what we have managed to do. Something meaningful, something valuable in our lives. So yeah.
They will spread the message.
We will.
I already thought, when I bring out How to Speak Cancer, this 3rd edition is it then, I will add a chapter in the prevention about oral health, because obviously I haven't yet, but it's such a nice reminder. You know what? I'll write it down right now.
Yes. You see, I published 2 papers about it. One was about the necessity and the influencing factors. So even though it is about older people, because I feel older people have very unique needs, the oral health, oral frailty has set in. Just like our body ages, our mouth also ages. And they already have, like, a dry mouth is one of the parts of being old. On top of that, when you go through cancer treatments, imagine you're swallowing, dysphagia, your taste, your mucositis, the ulceration is the worst, because this our buccal mucosa, that's the skin inside, the very thin skin around our mouth. It is the fastest growing replicating cell membrane in our body. So whenever we take chemotherapy, that's hit the first. And we get ulcerations. I've seen pictures, I've seen patients. You can't imagine, if you have even the tiniest of ulcers in the mouth, it hurts so much. Imagine you're already burdened with a cancer diagnosis, your family's done for it, and then this is just neglected. Because I remember talking to a ER person when I was in college, when I was doing my study, and she said, oh, Shalya, it's a long tunnel, and living long is the light at the end of the tunnel. And I was like, no, For me, that quality of life during your cancer journey is so important. And Kathrin, I must tell you, I've read papers where they say that compliance of the treatment, cancer treatment, has gone down drastically.
Yeah.
If your mucositis is so high because the patient cannot swallow, speak, or do anything, and the nutrition goes in, fatigue sets in, you can just imagine it's
Of
a
course.
cascade.
Yeah.
It's a cascade. And I think it'll be very good for you to join on 23rd April, because that's what we're going to talk about too. Oral health in older people with cancer treatment.
Yeah, sounds extremely interesting.
Yeah, lovely to, how do I say, connect with you on this topic. It's so beautiful.
Yeah. I would love to keep in touch.
Yeah, we will contribute to your book with whatever resources that you need. I'll help out.
Yeah, I love that. I have also started a blog, how to speak cancer blog. Maybe you want to write a guest article in there as the dentist. That would also be some option to share knowledge with the people. I would love to do that too.
Really nice. That'll be really nice. Yeah. Thank you.
Wonderful. I see we have a lot of ideas, as always. We are nearing the hour. So if you have a key message, what would it be? What is the one that you want people to remind after this talk? Your key message.
My key message is that oral health matters. It matters for you. It matters for everyone around you. It's because it's not just your health, your body, it's around your families. So take care of your oral health. Very simple preventable steps: brushing, rinsing, flossing, going to a dentist regularly. And I have a message for your writers, of all people who would want to join us in our mission to spread this word. We would be honored to have you. Thank you.
Wonderful. I can just add to that everyone in my community is also welcome, even if you're not a medical writer, if you're a patient, if you're working something completely different, your voice matters too. If you listen from Instagram and not LinkedIn, we are happy to have you in our resources database, because you're the ones who need to understand it, right? Wonderful. I want to thank you for today's talk. I know you have a lot to do. And yes, thank you for sharing all the information with us and raising awareness. It's such an important mission.
Thank you, Kathrin, because I'm happiest when I do this. So thank you for having me here. Thank you for this platform that I can spread something that I know and maybe motivate some people to do some more.
We will get more people. I know that. I feel that. Have a wonderful day, and thank you for your passion about everything. It means a lot to everyone who hears you. You know, it's infectious.
You know what? If I would end, it's my mom's birthday today. So whatever I am, because of my parents, they were both doctors, and they always taught me one thing, that you don't be proud that you're a doctor. Be grateful that you've been given a platform to serve people. They always did it that way. And for me, this part of my life is about helping people in a very different way. It's beyond the walls of my clinic into a bigger, wider world. Whatever I know is all yours. So thank you.
I'm sure your mom is very proud of you from wherever she watches you. I'm really sure she can just be very proud of you.
Thank you. Thanks so much.
Thank you so much.